Recognizing the member from Vernon-Monashee.
Thank you, Madam Speaker. I want to thank the member from Caribou-North for sharing her thoughts on doctor shortages. Madam Speaker, as we all know that this is a long-standing issue which we have been facing over a decade now. I have experienced this myself when I lived in rural part of northern BC from 2001 till 2012, not only as a British Columbian, but also as a healthcare provider. Over the years, I've also seen devastating impacts on patients and families, including my own family. Therefore, I feel strongly about our continuous effort and need to work collaboratively to address this so we can find creative ways and solutions to fill these gaps. Madam Speaker, I've also seen and witnessed a significant progress in hiring and implementation of policies designed to address doctor shortages since the BC NDP formed government. Our government recognized that there are doctor shortages at both the emergency and primary care levels, as well as rural communities, and we are addressing all aspects. We're working to transform our healthcare system into a sustainable one that will provide high-quality care for generations to come. While the scale of this change cannot happen overnight, it'll have a lasting impact. It takes 7 to 12 years to train a doctor. My older daughter is pursuing this path with the goal of helping people in rural communities. Health Ministry provided $815,000 to Health Match BC to support a targeted surgical recruitment campaign under the surgical renewal process. According to the surgical workforce report, as of 12 January 2022, 98 anesthesiologists and 9 general practice anesthesiologists have been hired, along with 82 surgeons. We're also increasing physician supply. A total of 362 entry-level medical residency positions are projected for 2022, whereas there were 134 seats in 2003. As a result of expansion, BC now has the single largest family medicine training program in Canada. In 2021-22, almost $163 million was allocated to support physician residency training in BC in 2017. This number previously was $135 million. These funds will continue to increase annually in 2022, 23, and beyond. Madam Speaker, BC has made 58 residency positions each year, exclusively available to international medical graduate candidates, especially to address the designated specialties and locations with the highest need. The 58 include 6 key specialty positions in psychiatry, internal medicine, and pediatrics, with the remaining 52 allocated to family medicine, all areas determined to be a great need of British Columbians. The ministry is also working on a program called Practice Ready Assessment BC. It provides a pathway to licensure for family physicians from jurisdictions outside Canada, with successful completion of assessment resulting in a provincial license and a 3-year return of service in a community of need. Currently, annual funding is provided for 32 para-BC candidates, and to date, 162 family physicians have been placed in 53 communities. Across all our primary care initiatives, over 150 new full-time equivalent family physicians, nurses, nurse practitioners, and other allied health workers are also supporting team-based care and meeting the patient needs, with close to 1,000 more on the way. To date, our government launched 53 primary care networks across the province. This really speaks to the necessity of having several options instead of a one-size-fits-all approach. My constituents are also benefiting from Urgent Primary Care Center in Vernon, and we have a dedicated team of healthcare professionals providing exceptional care. Recently, we also got a nurse practitioner in Lumbee. Our government is also in a process of launching Health Connect registry as a part of our strategy. Madam Speaker, I understand that despite the ongoing work of our government, we still have more to do. our BC NDP government is the biggest supporter of well-supported public health care. Lots of work is underway, and we are willing to explore all the options to address this so we can fill the gaps and British Columbians can get the care that they need. Thank you.